a basic home exercise program for TMJ pain and dysfunction. Hi, my name is Daniel. I'm a physical therapist, and I treat TMJ as well as other orthopedic conditions, and you can find me on my website, baloopt.com. So this is an example of the first exercise program I might give a patient after I do their examination. This is not a replacement for any professional examination and evaluation of your own pain. First, I usually have my patients protract their jaw, which means to jut the jaw forwards. So from the front, that would look like the bottom teeth are jutting in front of the top teeth. From the side, that one was relatively straightforward, but a lot of patients actually struggle with that, and many of my patients can't even move their bottom teeth in front of the top teeth. At most, they come to about the same spot. The next exercise that I will give them typically will be lateral glides of the jaw. Simply move your jaw from one side to the other. Again, pretty easy and straightforward, but often if you have pain, one side will be very difficult to go to, and the other side might feel easy. Often it's the opposite side from where your dysfunction is happening, but not always, which is why a professional examination can be very helpful. Now, to add to that, a lot of times I will add isometric lateral glides. This means resist the movement. So I will resist that lateral movement by pushing this way, and my jaw is trying to push the other way. So I'm not adding a lot of force. I could do it with one finger. And I'm just resisting my jaw from moving. I can do it centered. I can actually go to one side. Or I can go to the other side and resist it moving backwards. So you can do the isometric in all three spots. The next exercise I typically give patients is called controlled opening. You'll probably see this most common if you're just searching for different TMJ exercises. The tongue will be at the roof of the mouth. You don't want to press the tongue to the roof of the mouth because you want to be in a relatively relaxed position, but you want the tongue to stop yourself from opening the mouth too far. So stick the tongue at the roof of the mouth and then controlled open the rest of the way until you can't open any further because the tongue would come off. If you get pain, stop before that point. So those are typically the exercises I give patients. I also usually go into diaphragmatic breathing, relaxation techniques, some stuff with posture, depending on what they present with. Those exercises may work for you or they may not. A professional evaluation is very helpful, and if you feel like any of these exercises make anything worse, please stop and get professional help from a physical therapist or a dentist or a physician that can treat you for your TMJ dysfunction. Again, you can find my work at baloopt.com. The links are in the description.